Welcome to Season 2 of the Empower to Heal podcast. I'm your host, Dina Tipsherini, and I'm so excited to take you on a journey through the ups and downs of motherhood. Together, we are going to learn, prepare for, and unearth all things motherhood, because I believe that exposure and awareness can lead to empowerment. So buckle up for an unfiltered, raw, and insightful journey. Hey, I'm so happy you're back with us today. Today, we're going to be talking about answering the question, do I have postpartum depression? Now, this is a question so many mothers, parents try to understand in the first few weeks, months, in the year following having their baby. And it's a question that I feel like deserves a lot of focus because most of us think that postpartum depression means that simply we're not able to bond with our baby. We feel disconnected. We're tired and weepy. But there's so much more. And there's parts of postpartum depression that you should be aware of and consider, including what are some of your risk factors for experiencing postpartum depression? And what are some things that you can do to feel better? So we're going to answer all of your questions. Before we get started, I just want to say thank you for being here. Let's dive in. How do we answer the question, do I have postpartum depression? Now, postpartum depression is often confused with something called the baby blues. So before we answer this question, we need to identify, do I have baby blues or is it depression? Which one is it? What am I experiencing? Baby blues are often experienced anywhere from 2 days after you have your child to 2 weeks after you have your child. And the experience with this season is related to your hormone levels dropping. So when you have your baby, you birth your baby, you also birth your placenta. Oftentimes this is called the afterbirth. And when you birth the placenta is what holds and houses all of the hormones that your body had to build in order to grow your baby inside your womb. And out goes the placenta and out goes a bunch of hormones. And this rapid decline in hormones can send us through a loop. That in combination with sleep deprivation, which we experience the rapid onset of in a shocking way in those first couple weeks of our baby's life, these two experiences combined really can create and mimic depression. So what's the difference between baby blues and postpartum or perinatal depression? Well, depression in the postpartum season is the year following childbirth. That's what it's classified as in the mental health arena. And in this year following childbirth, you can experience all the same symptoms that you have in depression in the baby blue season and area of your life. In those first 2 weeks after having your baby, that's really predictable that usually 60 to 80% of people who have just given birth experience the baby blues. And we can guess that that hormone decline and that rapid thrust into sleep deprivation is going to mess with our mood a little bit. And this might look like you having some mood swings. It might look like you experiencing bouts of anxiety, feeling overwhelmed. Maybe you're sad or irritable. And then maybe you're crying off and on. You're questioning oh my goodness, what did I do? This is a rapid change from the life I had before. This is a lot. Your appetite might be shifting and changing, and you might be having trouble sleeping. Now, if these experiences continue past 2 weeks, that's when we start looking at, is it depression? And I would say when you're experiencing baby blues, we often experience the peak of this in the first week. So the first 3 to 5 days after having our little one. And if it continues after 14 days, then we're going to be looking at, are you experiencing signs and symptoms of depression? So what are signs and symptoms of depression? There's a lot of them, and I have a list that I'm going to review with you. And just because you have some of these symptoms doesn't mean that you are automatically diagnosed with postpartum depression or perinatal depression. These are usually if you experience 5 or more of these symptoms and you experience them every day for the majority of the day, and they disrupt your daily functioning, your ability to navigate family life or your occupational life, that's when we tend to wonder, okay, let's see if you're meeting the criteria for postpartum depression. So when you experience postpartum depression, a lot of people say that they feel like they just can't cope. They're really overwhelmed. They feel like they can't cope and they feel like they don't feel like themselves. They might have mood swings, feeling depressed, sad, like they don't have energy. They are exhausted. They're crying all the time. They might feel like they're having a hard time bonding with their baby and connecting with their baby. Sometimes people say that they feel like they're like watching themselves live life and they're like stepped out of their life. They might have a loss of appetite, or maybe they're eating too much or eating more than usual. Now, just know we should be eating more than usual when we have a baby, because if we are nursing, we are producing breast milk and we have to give that nutrition to our baby, but we also have to eat enough to nurture ourselves. And so if you feel like you're eating your feelings rather than just eating to satiate, feeding your baby and nurture and provide nutrients to yourself, then that might be a symptom. Inability to sleep. So many of you have heard of the word insomnia. Are you having a really hard time falling asleep when you get a chance to? Or are you having a hard time staying asleep? Now, this isn't a result of having an infant who is awake all night or waking you up from the middle of the night. This is when you truly have a window that you are able to sleep. Can you sleep? And can you sleep soundly and fully through that window? Or are you waking at times during your night, not because of your baby? Are you sleeping too much? Do you feel so exhausted that you feel like you can't get enough sleep? You are too drained to get up and do anything. You're just too tired. Sometimes it's hard to decipher if this is like the clinical sleep deprivation that we all feel in the first few months of having an infant, or if this is really us being depressed. So, are you getting enough hours that would have once satiated your need for sleep in a night? Let's say 5 hours. 5 hours is typically when we think of insomnia and we think of like what amount of hours we're trying to target. 5 hours is a good amount that we think most bodies can at least function, maybe not well, but function on. Are you experiencing overwhelming tiredness, loss of energy, less interest and pleasure in activities you used to enjoy? There's this transition that you go through in the early stages of parenting a little one, usually in the first year or two, where you do feel like you've lost yourself. You feel like all you are is mom again. And many of us yearn for the life we once had, the easy breezy nature and ability to go and do things that we were passionate about or that excited us, or go on adventures or engage in hobbies. And this phase of life really kind of quiets our ability to do that and can make us grieve. It can lead us to grieving the life we once had. And that's separate than not having any interest in doing the things that you once loved before, not gaining or feeling a sense of pleasure in things that once gave you pleasure in life. Do you feel intensely irritable or angry? Or do you fear that you're not a good mom? Do you have these worries that race through your mind that you're not a good mom? You're not built for this. You're not cut out for this. What did you do? Did you make a mistake? Are you feeling hopeless in motherhood? Or are you feeling shameful, worthless? Do you feel inadequate as a mom? Do you have these thoughts creeping in that look like that? Do you have a reduced ability to think clearly or concentrate or make decisions? And are you feeling restless? Sometimes symptoms of depression are also coupled with symptoms of anxiety. So, do you feel panicky? Do you have severe anxiety or panic attacks, thoughts of harming yourself or your baby? Do you have thoughts of wanting to die? or preoccupied with thoughts of death? If you are, you might be experiencing postpartum depression. If these are occurring within the first year after having your baby, if these are occurring longer than the first 2 weeks, this might be postpartum depression. And postpartum depression can have an onset in the baby blue season. We'll talk about that in a minute. But I also want to talk about the somatic experiences that we can have when we're experiencing postpartum depression. Sometimes we experience stomach problems, stomach aches, GI sensitivities or issues. Maybe we have headaches that are coming on or backaches, our body hurts. The reality is our body is the space and the place that holds our emotions. And so when we are depressed, our body feels it. We feel tired. We feel overwhelmed. We feel quick to anger. We might get more headaches. We might feel shaky, like we don't have energy to support our body. Our stomach might hurt. We might not be digesting our food like we used to. Our body might ache. It might hurt to bend down and play with your little one. Your back might hurt. You might be sore from laying in bed or sore from being up and around, and things that once were easy for your body might feel hard. Our body holds on to our experiences and our emotions, and our body wants us to express them. And so pay attention to what your body is saying as well. Motherhood is a beautiful journey, but it can also be overwhelming. Do you often find yourself feeling isolated, struggling to find balance, and yearning for a sense of identity beyond mom? Trust me, you're not alone. Join the Empowered Mamas Club, where you'll discover a supportive community of like-minded mothers. Gain valuable skills to navigate those highs and lows of motherhood, reclaim your sense of self, and become the engaged and present mom that you desire so that you can create cherished moments with your little ones. It's time to prioritize your well-being and rediscover the joy in motherhood. Click the link in the show notes and join us in the Empowered Mamas Club today. Now, let's talk about some of the differentiating factors of baby blues and postpartum depression. Now, we talked about the timing and the onset of the experiences. Baby blues is typically the first 2 weeks, and then postpartum depression is if it lasts longer than that. Now, postpartum depression can start. It can start in the first 2 weeks. It's just really hard to diagnose and understand, is this a result of the hormone fluctuations and changes, or is this truly depression? Because the theory around perinatal mood and anxiety disorders, the theory around postpartum depression, is that it is not related to hormones. Now, that doesn't mean that hormones aren't contributing to how you're feeling, but postpartum depression is said to be more related to your psychological shifts and changes, the changes in your identity, your sleep, less related to hormones. That's kind of confusing to say, because when I first learned this, what comes to mind for me is everything we do impacts our hormones. Our sleep impacts our hormones. Our stress impacts our hormones. Our nutrition impacts our hormones. Changes in life experiences impact our hormones. Feeling like we're in survival mode impacts our hormones, right? But what comes first, the chicken or the egg, right? Is this caused by hormones, or is this caused by the collective experiences and shifts that you're going through in motherhood that are really impacting you and leading to feeling depressed? Also, severity and intensity is something we consider to differentiate the baby blues and postpartum depression. Postpartum depression is far more intense and severe than the baby blues. The baby blues might have the crying spells on and off, but you might not feel worthless, right? You might just be adjusting and feeling the adjustment and the change and the pressure and the shift of those birth hormones, those sex hormones, like rapidly leaving your body. And then we talked about the duration and how chronic it is. So when we think about something being chronic, like this is impacting us all day long, every single day, right? The majority of our day, every day of our life, it's impacting our ability to do simple daily tasks that we could have done previously, navigating in social environments, being able to keep our house together, get out of bed, shower, do the tasks, activities of daily living is what we call them, the daily things we do every day become difficult. Going to work, maybe even harder. Navigating the pressures of work on top of what you're feeling. You just might not have the energy. So that's really how we differentiate the two. Now, I want to speak about postpartum depression a little bit. The statistics are that 1 in 5, I spoke about this previously on another episode, but 1 in 5 parents who have just given birth will likely experience and report experiencing postpartum depression. And postpartum depression for people who have given birth is usually 1 in 5. During the pandemic, it was 1 in 3. And these are just the people who are reporting this. If you're like me, you might not feel comfortable reporting this information. When I was screened for my perinatal mental health, I was handed a screening tool at my 6-week checkup. And I read through the tool and I asked, what is this going to be used for? And they shared, well, it's to identify if we need to send you to refer you out to a therapist or to put you on some antidepressants to help with your mood. They said it's very common that mothers are put on antidepressants to support them in the season of life. Well, I was of the mindset that I didn't desire to put medication in my body, and I was a therapist at the time, and I wasn't looking for talk therapy in that season of my life. And that was just a personal preference. I am a therapist. I believe in talk therapy. I provide therapy to mothers in the postpartum season and the perinatal seasons. I believe in it wholeheartedly, but it wasn't what I was looking for at that point. And it felt like there was a gap in options for me. Like I only had 2 choices if I filled out this questionnaire and they read it and thought that I needed support. And so I decided to answer it as if I was completely fine. I straight up lied on the screening tool because I knew what my options were. And they told me ahead of time, and I knew it wasn't going to serve me. And so I didn't feel like it was important. I gave them the screening tool back and they didn't even look at it. The person that was in the room just set it on the counter, didn't read it. And then the midwife that came in afterwards to do my 6-week checkup didn't look at it either. She did ask me questions like how I was feeling and make small talk. There was discussion around how I was healing and what that meant for my body and if I was cleared to have sex again. But outside of that, that was it. And so I share this information with you because I'm not alone in that experience. The majority of moms that I've spoken to have felt the same way. And some have said they filled out the questionnaire and they thought it was going to lead for help and it wasn't looked at. Or the help that they received wasn't exactly what they were looking for. And so it felt like their hands were tied. And I want to share with you, your hands are not tied. We have learned so much about things that can contribute and support us in this season of life. And postpartum depression is complex, and oftentimes it's connected to other mental health experiences and struggles that we call comorbidities. And women with postpartum depression commonly experience comorbid obsessive compulsive thoughts. That was me. So compulsive thoughts, intrusive thoughts, that were obsessive in nature, and they were all thoughts that I couldn't control. I didn't like. They were scary. They didn't make sense to me. My brain was preoccupied by them. I couldn't turn them off. I felt like I had to change things in my life to create a sense of safety because my thoughts felt unsafe. And I needed to do something physically to react and create that safety, which contributed in kind of the cycle of anxiety. And it's not uncommon for us to experience intrusive thoughts. And that's where the comorbidity of like the anxiety and the OCD may come in. In the next couple episodes, I'm going to dive more into those other perinatal mood and anxiety disorders. Today is just about baby blues and postpartum depression, but I did want to share that information. Now, you may be listening to this and you may be wondering, why me? Why am I one of the 1 in 5 that experience this. Or maybe you're a partner and you're like, why am I the 1 in 10 who's struggling with postpartum depression? Why me? Well, the research has showed that there are a handful of risk factors that support or can support development of postpartum depression. Depression during pregnancy is one of them. So if you struggled in pregnancy, you're likely to struggle in the postpartum season. If you had anxiety during pregnancy, you're likely to struggle with depression and anxiety in the postpartum season. If you experience stressful life events during pregnancy and before or surrounding your birth, can contribute to postpartum depression. Many people who felt like they lost control, everything was out of their control during the birth of their child, experience symptoms of postpartum depression. If you have low levels of social support, if you have a personal or family history of depression, or if you're a woman with a history of postpartum depression from a previous birth, you're also at increased risk for reoccurrence of postpartum depression. Now, this isn't taking into consideration that there's things outside of the postpartum season that can contribute to postpartum depression. And these things could be trauma. It could be financial instability or poverty, lack of a support system in the world around you. It could be a history of adverse childhood experiences. Some people are more genetically predisposed to experiencing postpartum depression. So if their siblings and their parents or their grandparents have experienced postpartum depression, they have a higher chance of experiencing it themselves. Also, endocrine disorders. Those with endocrine disorders can have a higher chance of experiencing postpartum depression. There's a lot of things that can influence this for us or put us at risk. But there are also things that we can do to protect ourselves from experiencing such severe postpartum depression. So it can decrease the severity and decrease the intensity and how long we experience postpartum depression. And a lot of those things are rooted in your community and your support system, learning skills and tools to regulate your nervous system. Cognitive behavioral therapy is a proven intervention. Being able to understand and identify what are your experiences and are they rooted in possibly depression that occurred before pregnancy and is reoccurring as you step into the postpartum season or through pregnancy. Difficulty with adjusting to big life changes. So how do we support and prepare for those life changes in a more empowered way? How we nurture our body, how we support our sleep, what we're doing to practice mindfulness and support new growth in neural pathways developing in our brain. We can do a lot of things to prevent experiencing postpartum mood and anxiety, perinatal mood and anxiety disorders, or to decrease the intensity of them. And if you're interested in learning about this, reach out to me. I have a course in a community that can support you in preparing and also navigating through this season of life. I do want to speak to the information out there around treatment interventions. So therapy is a evidence-based intervention that can support you in treating your postpartum depression. And in mild cases, therapy may be all that you need. I always say, like, air quotes, all that you need, because community can't be replaced by therapy, right? A support system that is aligned with you and your values and respectful to you and actually stepping in and caring with you and for you and mothering you as you mother your baby, not trying to take over, not trying to force their ways, but truly supporting you. That is invaluable and will go so far in supporting your healing. It is the number one protective factor. But there's a lot of things that we can do, like I just mentioned. But therapy in the world of the clinical realm and in perinatal mental health is the number one intervention that we recommend for mild cases of postpartum depression. If you have a lot of those symptoms that I read off earlier, if you experience a lot of those every day, all day, you might have more severe case of postpartum depression. If you are struggling with thoughts of wanting to hurt yourself or others, thoughts of death or wanting to die, that might be a more severe case. And in more severe cases, especially when there is risk involved for the safety of you and others, a lot of times your doctor will talk to you about psychiatric interventions. Psychiatric interventions means medication. So, seeing a psychiatrist to talk about your feelings and experiences, and them then exploring your history and identifying what type of medication would best support you. And they'll be able to weed out risk factors and see how they can support you. Now, when I was going through my experience in the postpartum season, the first question that came to mind for me is it safe for my son? If I put this in my body, will it go into his, and will that impact him? I wasn't experiencing a quote unquote severe case. And so I was able to navigate through my postpartum depression and anxiety and intrusive thoughts in a way that leaned heavily on skill development and emotional regulation and building a community. But if you do need support, there is no shame in that. There are medications out there that are considered safe to take while breastfeeding and while pregnant. And a lot of information shares that if you are taking medication prior to pregnancy to support your mood and then you stop abruptly, you're at higher risk of experiencing depression, anxiety, bipolar, psychosis in the pregnancy season and the postpartum season. And so I'll always talk with your doctor if you're wanting to come off your medications to do so in a way that's supportive for you and in a way that helps you understand what your risk factors are and what you can do to build protective factors. Now, all medications pass into breast milk. All medications do. But the extent of the passage varies considerably between all drugs. So I'm going to list a few drugs that are common first-line antidepressants for people who are experiencing depression, not bipolar, but depression in the postpartum season. And these medications, when administered and taken in therapeutic doses, are associated with low to undetectable serum concentrations in breastfed babies. Now, these may be I'm going to mess up the saying of these. These may be citalopram, nortriptyline, sertraline, and paroxetine. You can talk to your doctor about any other medications you may be on, and you can also explore what's the purpose of them. What are they going to do inside your brain? Are they going to increase serotonin in your brain? If so, are there other ways that you can get that? So I saw a holistic functional medicine doctor in my postpartum season because I wanted to heal my gut to support healing my brain. And I knew that serotonin was largely created in your gut. It's like crazy, like 95% or something, some crazy percentage of serotonin is created in your gut. And so I wanted to heal my gut to support my brain. And your gut is considered your second brain. And so she did prescribe me things like 5-HTP-CR, and I started on a vitamin D and probiotics. A lot of times probiotics can support people with mild, I should say, experiences of postpartum depression and anxiety. Just including probiotics into their diet can support them in feeling better. So know that you have options. It doesn't just have to be psychiatric medications. Our brain is not separate from our bodies. Our emotions are not separate from our bodies. Our gut controls our emotions. How we move our body produces new hormones that help us feel different ways. Sleep impacts how we feel. Relationships and connections impact how we feel. We are such diverse human creatures. And so think of your healing in a broad, diverse way. It doesn't have to be a one-size-fits-all therapy and medication approach. And if you're on medication and you're engaging in therapy and you still feel like you're not getting the relief you were looking for, know that there's other complementary alternative interventions you can implement to support your healing, like taking a look at your nutrition, like joining a support group or a community, engaging in expressive arts, journaling, songwriting, singing, dancing, painting, you name it. There's so much that you can do to support healing and feeling better in this season of life. And it's not just talk therapy or psychiatric medications that make the difference. All of these things work together to make a difference. And you can take bits and pieces of what you like and what you don't like, and what feels aligned and what doesn't feel aligned, and what's working and what's not working. And you can create your own plan for your support. I hope this information served you and helps you in feeling like you're walking away from this podcast episode knowing, do I have postpartum depression? Next time we gather, we're going to be talking about, do I have postpartum anxiety? And what does that look like? I'll see you next time. Motherhood is a beautiful journey, but it can also be overwhelming. Do you often find yourself feeling isolated, struggling to find balance, and yearning for a sense of identity beyond mom? Trust me, you're not alone. Join the Empowered Mamas Club, where you'll discover a supportive community of like-minded mothers. Gain valuable skills to navigate those highs and lows of motherhood, reclaim your sense of self, and become the engaged and present mom that you desire so that you can create cherished moments with your little ones. It's time to prioritize your well-being and rediscover the joy in motherhood. Click the link in the show notes and join us in the Empowered Mamas Club today. It has been an honor to share this space with you today on the Empower to Heal podcast, where we illuminate the strength you have within yourself to heal. Make sure you subscribe so you don't miss our upcoming episodes, and leave us a review on your favorite podcast platform.